Mr. King. How are you?
Good. How are you doing?
I'm doing wonderful. My name is Dr. Lewis. So what kind of day have you been going through?
A busy day just getting here.
Okay. Well, I have like a couple of basic information I want to ask you before we actually get into our session.
Okay.
So it's just going to be like a basic information about your background, you know, just to see what type of environment you're from.
Okay.
Okay. What's your date of birth?
1/1/94.
Okay. And your age?
21.
21. Oh, wow. Okay. Can you give me your full name?
Clark Mitchell Kent Jr.
Okay. Is there a certain name you like to be called?
Clark.
Clark? Okay. I like that.
Thank you.
Okay. Your address?
17 Maple Way,
Mm-hmm.
Port Wentworth, Georgia.
Okay.
31407.
Okay. Is it the same as your mailing address?
Yes.
Okay. Okay. What do you identify your race as?
White.
Your ethnicity?
American.
Have you ever been married? I know you're young. Have you been married?
No. Dated a couple of times.
Oh, gosh. Okay, and with this information, if anything was to ever happen, what's the emergency contact that we can use for you?
My mom, Josie, Joscy,
Mm-hmm.
Kent, Kent.
You said this is your mother?
Mm-hmm.
Okay. Can I get a home number for her?
912 is her work. 356 9292. She carries it to work in and with her.
Okay. And who was responsible for paying your bills in your household?
My dad,
Your dad?
Clark Kent Sr.
Okay. Can I get a phone number for him?
912 965 3000.
Okay.
He never answers the home.
Can I get a work or cell number?
That's his work.
Same thing?
Mm-hmm. Just call my mom if you need to talk to him, or you can call him at work.
Okay. Can I get a social security number?
257 82 9636.
And then is the address the same as before?
Mm-hmm.
Okay, before we continue, I just want to let you know that this information that you're giving me will be confidential. We would not, disclose this information unless it's causing any harm, hurt anyone to yourself or people around you.
Okay.
But as far as me giving out your personal information, that wouldn't happen.
Okay.
Okay, so what are you seeking help for today?
I've been having some anxiety and depression.
Okay, you want to talk a little bit about it? Like, what's causing this anxiety and depression?
I've had it before. It started in my teenage years, and it just seems to kind of be coming back. I just recently got a job, and I think just all the newness of it.
Yeah. So you said when you was a teenager, what type of issues or situations happened that causes anxiety and depression?
Well, I saw a counselor,
Mm-hmm.
and a psychiatrist then, and I talked to them a little bit about it, and they seemed to think, that what happened to me when I was 4, had something to do with it, and then maybe a family history too.
Okay, would you like to talk about what happened with you before?
Not really, but I will. I was molested at age 4 by a cousin,
Okay.
and then I had teenage drug and alcohol abuse.
Okay. So do you feel like you're coping better with this now that you're older, or is the issue becoming more so a problem in your life?
It comes and goes.
Yeah. So who referred you here today?
My mom.
Mom.
Yeah, we've been arguing. She said it's time.
Okay, in the last year, has your income increased or decreased?
Increased.
Have you missed any days in college or work?
Mm-mm.
None.
No. I downloaded your paperwork, so
Yeah, I kind
I
of
can
know.
write a few things
Yeah.
down.
Okay, so give me like your goals of this therapy. Like, what are you trying to take away from it?
I don't want to do any medicine. It makes me feel weird,
Okay.
and I just want to be able to go to work every day and just have a better life. I hate my life
You hate your life?
sometimes. When it's like this, you know, like when my heart's racing and everything. And I saw a doctor, and he said that I had a hyperactive autonomic nervous system,
Mm-hmm.
and to walk 30 minutes a day. And I was doing that, and I was jogging, and then I had to quit because I had knee surgery in February. And I just got through doing the therapy for it
Mm-hmm.
after my surgery, and he said I could start jogging again. So I've done some walking over the past couple of weeks.
Okay. Okay. So, like, what gives you your relief? Like, what makes you feel like, wow, I'm calm?
Playing guitar,
Playing guitar.
yeah.
So, if we set up some guitar lessons, you think like that it help with your feeling of hating life go away a little bit?
I play on my own, but that'd be good. I'd like to play with somebody maybe.
Okay. So, who stays with you?
My mom and my dad and my two sisters. My sisters are Sarah and Becky.
Okay, Sarah's a beautiful name.
It's after my grandmother.
Okay, do any of these work part-time or full-time?
They work part-time, and they're both students. They're both seniors.
Okay, do your parents work full-time?
My dad does.
And your mom, she's
part-time.
part-time? Okay, are you in a relationship with anyone? I know you're not married, but are you?
No, I have some girlfriends, but I'm not dating anybody right now.
Okay.
They're mostly friends.
Okay, how are your relationship with your friends?
Good.
Good?
I have a few. I don't have many,
No.
but we're close.
Okay, do you receive any emotional support from your friends?
Yes.
Is it enough?
I think so. Yeah. I'm not sure anybody really understands me.
Think so?
Maybe.
Okay, is there anyone else in your life that give you emotional support?
My mom and my
Mother?
dad. I'm close to my sisters.
Okay, so we know we stated before that in your childhood at 4 years old you were molested. And then once you became a teenager, you started experiencing anxiety and depression. How would you rate your childhood with those type of obstacles that was encountered?
It was good. I think I got angry towards my teens.
Mm-hmm.
Started drinking and doing some drugs. And
Yeah. So how's your relationship with your mom?
good.
Good.
We argue a lot,
Mm-hmm.
but she can take it.
I think mother and daughters argue a lot. What about your father?
We're close.
Very close?
Yeah, we work on cars together.
Okay, what about with your friends?
We're close. They
So you're rated as good, fair,
good.
and your other family members, like your sisters, aunt, uncles?
Yeah, we're close. One of my sisters stays with her boyfriend all the time, though. I mean, he's always there, and I don't think I like him too much. But it's all right.
Yeah, that's understandable. Everyone likes their own space. So has a relative or a significant other died in the past year?
My grandmother died in October. She was old.
So she died at old age.
Mm-hmm.
Do you think about her a lot?
Some. Yeah, I miss her. I know my mom misses her.
Yeah. So you have to be there emotionally for your mom as well.
Yeah.
So do you have any children?
Mm-mm.
No children? on to like your religion and your culture. And if any questions that I ask make you feel uncomfortable, just let me know and we can skip over those and keep going on with the assessment.
Okay.
Okay. What's your like religious standpoint?
Well, I was raised in church, and but I'm not sure there's a God now. I mean, my mama tells me Jesus loves me all the time, but
From certain situations makes you feel like it's not true.
I know she believes it.
Mm-hmm. And what would you say your spirituality is?
I like music.
Okay, is there any cultural or ethnic things I should be aware about? Mm-hmm. No. Okay,
My mom probably says I'm racist.
Racist?
My dad's racist.
Okay, are you enrolled in school, college, or any type of training?
No, I did Savannah Tech and I finished that, and so I was able to get a job.
Did you enjoy it?
I just got it with one of my best friends works there,
Okay.
so, but I'm real nervous.
Why?
I mean, I know I do a good job, but my heart's been racing, and
Due to the other things that are going on?
yeah.
Understandable.
I hadn't told my mom
About the job?
about my heart. I told my dad about it.
So you have been having heart issues?
Well, my heart's been racing again, since I started this job a few days ago. And I want to keep it, so
Have you had heart problems before?
just a few years ago, and then he told me to, walk. And I took some heart medicine for a little while to slow it down.
Okay. And so what did you receive your degree in from Savannah Tech? That's a great accomplishment.
Aircraft structural technology. I don't think that's what I want to do all my life. I want to go on the road and play music.
I have a passion for music as well. Okay, so you're a full-time,
Yes.
and where do you work now?
Aircraft Supply Creations.
Okay, like kind of give me a description of what you do.
I'm a machinist.
Machines?
Yeah, we build aircraft parts and sell them to Gulfstream.
Okay, do you get along with your coworkers?
Mm-hmm.
And what about your supervisor?
Yeah, they're nice people.
Have you served in the military?
No, I
Are
thought
you-
about it. I
Are you
wanted to.
interested, like even though you know with the job, like the Air Force or anything?
I wanted to, but with counseling in the past, I'm not sure if I'm gonna be able to. I like guns, and I think I'd like that.
Okay. Have you ever been arrested?
No,
Are you in probation,
no,
parole,
no,
in drug court,
no,
domestic violence court?
no.
Okay, the next session is gonna be over alcohol and different drugs, so I need you to be like completely honest, because you mentioned before, you started using drugs, so with this, we're gonna be completely honest and just give full answers. Okay, do any members of your family use drugs or alcohol?
My dad drinks on the weekends.
Do you have a family history of alcohol and drugs?
Yeah. But
Okay. Have you felt like you should reduce or stop smoking cigarettes?
no, I quit all that. I went to rehab.
From marijuana?
I'm done.
So you don't do any alcohol or drugs?
I'm taking aspirin. Not unless I have a really bad headache.
Has drinking in the past caused any issues among school, work, friends, family?
Yeah. I ended up in rehab for a week. They put me on some Xanax for my anxiety, and I drank and took some Xanax and ended up in rehab for a week and came out clean. I saw a lot of people that have lost a lot of things.
Has anyone ever expressed concern about you drinking
Yeah,
or smoking?
my mom.
Did your personality change under the influence?
Probably a little bit, yeah. I don't think she really knew how much
You was drinking?
No.
So give me an estimate on how much you used to drink.
Well, I had a bottle of cinnamon rum in my closet, and you can't really tell the smell of that, so I would pour some in a glass and drink it alone.
With something like a chaser or something.
No.
Have you ever blacked out while drinking?
One time I went to the hospital one time because I drank too much at the beach.
And how long have you been clean?
3 years.
That's wonderful. I really want you to know that. It's wonderful.
Yeah, my heart races and I'm pissed all the time.
Yeah.
Not all the time, but a lot of the time.
And you've been clean for 3 years, so none of this applies to you. Okay, let's talk about your medication that you're on.
I don't take
This-
anything.
Nothing.
They tried, I think every antidepressant made. They just made me feel weird, and I ain't taking that.
Okay, when was the last time you took an antidepressant?
I guess 3 years.
3 years ago? Okay,
2 or 3.
Can you explain to me the weird feeling?
I don't know, it just makes me feel weird.
Like in more so your head?
Yeah,
And do you think it contributes to your heart racing?
I think it does. It just didn't help. I think my music and
It's your
exercise,
medication. Natural medication.
Yeah.
Okay, you want to describe any significant diseases, surgeries, or injuries you had in the past?
Just my knee surgery.
Knee surgery. How long did it take you to recover?
2 months.
Okay, do you have any allergies?
Kiwi.
Okay, and I sent this information out. Would you need time to note down your primary doctor number? So can I get your primary doctor number?
Christian.
Christian?
I wrote this number down. 350 7500.
And your psychiatrist?
Winders, but I haven't seen him in a while.
When was the last time you seen him?
2 or 3 years ago.
Okay, his cell phone number?
I don't remember. I'll give it back to you.
Okay. Is there the name of the agency?
Savannah Psychiatry.
Okay, I can pull it up.
Okay.
mental illness, job problems?
I had an aunt that had depression and anxiety, and she was suicidal, and she had schizophrenia. I had to ask my mom what else she had, and then she had a bunch of stuff.
Yeah. And this the only one in your family?
No, I had an uncle that was paranoid and had anxiety and depression.
So anxiety and depression is one of the social issues that runs a lot in your family?
Yeah, those two. And then I think my grandma had some anxiety. And then I had an uncle on my dad's side that had depression.
Okay. And you say you have been to a counselor before?
I've done that.
Okay, in the last 6 months, have you thought about hurting yourself or people around you?
I thought it'd probably be good. Maybe if I didn't have to get up every day for this.
Have you attempted suicide?
No.
Do you have plans right now to harm yourself?
I don't think so. Maybe, I don't know. I don't think so.
Okay, how often have you been getting out of the house lately?
I just was able to start walking again, so I've been walking for about a week or two, and my dad and I have some parts on order. We're fixing to restore this other car.
So you've been getting out doing things you enjoy?
A little bit, when I can.
Are you concerned about any sexual issues from the past or the present?
Just, what happened. I'm mad because my mom said there was nothing she could do to an 8-year-old, but what can you do with an 8-year-old?
Yeah. Has your appetite changed any?
I'll eat, I eat, but the last couple of days I haven't wanted to eat too much.
So has your weight changed or gained?
No, I need to lose some weight. I feel like I need to lose some weight. My mom says I don't, but I feel like I do.
You look wonderful, so I don't feel that.
Thank you.
Okay, what about your sleeping patterns?
I go to bed, and then I get up during the night, like 3 times maybe. I'll get something to eat, and I'll go back to bed, but then I'm tired all day. And I did a sleep study thing, and it didn't show anything, and they probably don't know what they're talking about anyway.
Okay, we're gonna move on to violence and trauma, so you can give me a little insight on that. Were you a victim of any violent crime?
No, not violent. Just that thing that happened.
Situation.
Yeah, he spent the night with us one night at Christmas time.
Did this happen more than once?
No.
Were you ever forced to have sex by your spouse or significant other in the past?
No.
Okay, has anyone ever followed up with you off of the situation that happened?
I've seen a counselor, seen a psychiatrist. I'm still mad. He's in jail now, and I'm glad.
So if we set up some counseling, would you like that, more on a group level? You guys want to no group level?
No.
So you like individual counseling?
I'm only here really because my mom wants, me to touch base with somebody.
So what would make you feel more comfortable about coming to see me?
if you got some way I can do this without taking drugs, because I'm not taking any drugs.
You can do it the natural way, like I stated before. Okay. Are you currently afraid of someone hurting you right now? Do you have any flashbacks?
No. I'll probably think about it a lot in my downtime.
Nightmares?
No.
Do you feel fearful that it'll happen again?
No.
Do you feel numb after the situation?
Probably.
Okay, what would you feel like would help you with therapy? And I'm going to just read out a few options. And one that, strike your mind when I say it, just stop me there.
Okay.
Support from your family.
Yeah.
Support from your spouse.
No.
Your friends.
Yeah.
Connect to self-help groups like AA and the NA.
No.
A positive and supportive sponsor.
No.
Connection to a church.
No.
Counselor, case manager.
No.
Psychiatrist.
No.
Judge or probation officer.
No.
Your employer.
No.
Financial security and assistance or benefits.
No.
Permanent residency.
No.
Do you feel like you can be motivated?
I'm going to go to work every day and see how it goes. I mean,
And how are you with your self-esteem?
I'm alright. I play guitar good. I'm a big machinist.
Okay, what do you want to derive from the therapy? More understanding about your problem and why it happened and how is it affecting you?
I just want to know.
How you
I think I just want to please my mom. I kind of just want to go through this and then she'll know I've done it. And I just want to work on cars and play guitar and go to work.
So you say you want to please your mom. So with this therapy, you don't really want to say with it, it helps you overcome the feelings that you're feeling. You think that help you more so than you having the mindset of pleasing your mother?
Maybe it'll get better, with
It's
this
only
job.
the first day.
Maybe it'll get better.
Is there any questions you want to ask me?
No.
Okay, so would you like to set up, we can set up another appointment. Is next Tuesday at 10 a.m. good for you?
Do you have anything around 5?
We do 5.
Okay.
So Tuesday at 5.
Yeah.
Okay, and with your heart medication, I'm gonna send you some resources so you can find different medication that will, soothe your heart, so we can kind of get down the racing feeling a little bit, and we can send you to a heart doctor so they can check out everything to make sure everything is normal, your vitals are good, because it may be something else that's causing the heart racing, that we're not aware about. So we can set that up, and when you come back on Tuesday, you can give me more feedback and a follow-up of what happened with the doctor.
Okay.
And that appointment will be this Friday
Okay.
at 12 a.m., not 12 p.m.
Okay.
And then the receptionist, when she goes out, she can give you the information as far as where is it located and everything. And when you come back, we can talk more about the depression and anxiety and how we're going to take an approach on that way without medication.
Okay.
Okay?
Right.
There we go.
Good deal.
So it was nice having you. So I will see you on Tuesday at 5. And is there anything you need from me?
No, I appreciate it.
Okay, have a wonderful day, man.
You too. Thank you.